we wanted to record the actual demos that you're going to be doing and give a calibration for the recommended way that we want to use the lexicon and the steps. Everyone tends to customize things just a little bit, but we want to stay as true to the sequence as possible. So when I start this exercise, what I like to do, people are really interested in the radius bevel and they love a rule. So the rule is, as we know, we're going to create a convex bevel. It's not flat or concave, it's convex. And I also like to describe what we're not doing. Describing what we're not going to do or describing how to do it wrong is also how to describe how to do it right. So I'll say we're going to do a radius bevel, and the radius bevel for blending, for aesthetic blending and for structural blending needs to be the same amount as the division 2 structure. So this cavity, how wide do you think it is? Maybe 3 millimeters wide? So our radius bevel, and it's nice to do this very elegantly. I'm going to need to do a radius bevel that's the same width as the division 2 structure. Now, as we get to the gingival part of the tooth, as we know, the enamel gets thinner, so we're going to have to compromise on that rule and do a lot less reduction as we get into the gingival portion. Now, once we injection mold, to get the true infinity edge, once we're going to discover, in quotation marks, discover our infinity edge, that infinity edge needs to always be past the bevel. So we're going to injection mold and then marginate later to an area that's going to be outside of our radius bevel. If you finish back to the radius bevel, you're going to get a white line. So one of the secrets of Bioclear is to always do our infinity edge past the radius bevel onto clean blasted enamel. So let's go ahead and cut the radius bevel now. Now in your Bur Kit, you've got a few choices, and we're changing our relationship with our burr supplier. Comet is going to be phasing out, so we're going to continue to use this Comet burr block for a while. So you can grab this little Hershey's Kiss burr if they want, or we can grab this burr number 2. We like to have these burr blocks numbered like this. So let's go ahead and start with this radius bevel burr because it really gives us a better form to work with. So the radius bevel needs to be tangential to the inside and then tangential to the outside. So we're parallel to the inside of the defect, and then we're parallel to the cable surface or the outside of the tooth. And remind everyone that the radius bevel should be definitive. It's not a ragged bevel anymore. That's what we used to do. So you do have to move the burr in several planes. Try not to nick the neighboring tooth, but we know that the number one area in the classes that people tend to not give enough reduction is right near the contact. So we're going to remove some of the enamel on the facial surface of the contact, but leave the contact intact and don't disturb the incisal edge. So that's the radius bevel, and we'll give them a few minutes to cut that. And once again, we want to have a very definitive, not ragged infinity edge. And then our tooth restoration is going to be out here. Now, if the doctors want to roughen up the enamel so that we get better adhesion, they certainly can. So I'm going to grab the number 3, or the number 2 burr in the burr block, this coarse green flame, if they want to roughen up the dentiform so they get better adhesion. Now, once again, we would never roughen the tooth up like this because now we're cutting all of that area. So if we don't want to roughen it up and you want to just wipe off the black dots with some alcohol or something, that would be okay. But once again, we would not remove this enamel here with a burr. We would just blast this area. So it's kind of up to your discretion on this because we're not sandblasting these teeth before they go out. Now on the lingual, we just do a standard adhesive bevel. It's about 3/4 of a millimeter to do a standard bevel here, and it can be sort of flat-ish. It's just a standard adhesive bevel, somewhere between 3/4 of a millimeter and 1.5 millimeters. That's all we need on the lingual. So that's the beveling. Okay, so we've got that all done, and then the next thing we'll talk about is grooming the contact. So before we try in the matrix, we're going to go ahead and groom the contact. Now, when we love to use rubber dams, so we're going to bring in the first sander, which is the blue, and we're going to go distal to the canine so that the rubber dam goes in without tearing. This is your Scout. We like to call it a Scout. It'll go anywhere. It's very strong steel. It'll go between any contact. I'm feeling a very sharp contact right here. That would have torn the rubber dam. So my dental assistant uses the blue TruContact saw between each contact for each rubber dam, because there, frankly, are a lot of crummy contacts out there. Okay, so before we try the matrix in, we're going to go ahead and groom the contact again with the sander. Now we're going to use the orange sander. It has no diamonds on one side, and it has medium grit diamonds on the other side. We want to go up, down, buccal lingual to make sure that the matrix is going to seat without a problem. We know that what seals the gingival margin of the Bioclear restoration is the actual attachment, pressing the beautiful mylar against the tooth. And the number one reason that we don't get our matrix seated is because the contact hasn't been properly adjusted. So once again, you have to go up, down, and buccal lingual to make sure that the matrix is going to be fully seated. Very often we're fooled. It's one of the biggest problems with Bioclear, believe it or not, is that the contact is not letting the matrix seat completely. All right, so we're going to go in and we're going to start with the O2 matrix from the classic matrices. So once again, we always say the hardest thing about Bioclear is opening the box. So you got to break the safety seal. So grab the corner, pop it open. Then it's a lot easier. They try and do it here, it kind of hurts your fingers. So once again, they all laugh. Hardest thing about Bioclear is opening the box. So grab it on the corner, break the safety seal, and then grab the matrix. So the matrices tend to nest together. Make sure that you're getting just one matrix. This is the O2 matrix. And I'll let you, we're only going to really describe what we're doing in the exercises themselves. I'm not going to talk about the conversations about the matrices. You folks know all about the way you like to describe this O2 matrix. So our matrix has been properly, our contact has been properly groomed. We're going to slide the matrix in. It's good to angle it in like this. And there should be a just right amount of tension here. There should be just a little bit of resistance, but it shouldn't be too tight. Do not just shove on the insides of the ledge like that. That'll just stress the mylar. You want to grab the matrix, squeeze it, pinch it, brace it. I'll use all three of those terms because these are foreign. Anytime we're doing something they've never done before, we have to really go slowly and explain 2 or 3 times. So we're going to brace it, squeeze it against the tooth, and then we're going to drive it all the way to the attachment. Now, the great thing about this exercise is, and we picked this dentiform, is that it actually feels very similar to what you're going to experience clinically. And please say that. You're going to drive this matrix all the way to the attachment. And then the first question people say is, do you give the patient anesthetic on the palate? And the answer is no, because this hugs the soft tissue. It doesn't really create pain. And number 2, do you get a lot of bleeding? And the answer is actually no, because if you want to see bleeding, use a flat piece of mylar. A flat piece of mylar will literally slice the papilla. And then if you want to get a lot of bleeding, make a nice clean incision, all right? Like a nice paper cut. Because this braces the tooth, it actually compresses the papilla and we get a lot less bleeding. So we can talk about bleeding if we get bleeding at the wrap-up. So let's all drive the matrix apically, and then let's take a look from an incisal view. Now, this is not a completely veneering matrix. You can see that it doesn't actually cover the entire defect here on the facial. We have matrices that wrap the tooth more past the midline, but we're not going to use one of those right now because we wanted you to get to know this matrix. This is a great matrix for class 3s where we don't want the matrix to cover so much of the tooth. So obviously for this tooth, it might have been favorable to use something that wrapped a little bit more, but it's not a big deal. This is a great matrix. It's got a great shape. It's going to get a great gingival seal. The contact is sealing the gingival margin. Because we have a reasonable contact, it will seal the gingival margin. So let's go ahead and do our first exercise. Now, we're going to go ahead and acid etch, and we're going to acid etch out to our infinity edge area here. And we would acid etch all the way to here. We're not doing that today, but this tooth has been disclosed, blasted, and now we're going to etch to there, rinse and dry. And then we're going to go ahead and we're going to massage Scotch Bond Universal Plus into dent and tubers for a full 20 seconds. Now, what I always do is I get out their little baggie, which I'm not going to use for most of the exercises. I'm just going to get into the baggie and say, okay, this is the little snappy thing. I don't use the snappy thing clinically, but we do use it on the road. So go ahead, come in here, and I never knew how to use these things. What you want to do is you want to grab this, pop it, and then squeeze all of the resin out of the big reservoir into this little medium reservoir there, and then you can use your applicator. Now, from that point on, I'm not going to use the applicator well. I'm going to use one of these things to make my life better, but we don't need to tell them that, okay? Because they've got the little Unidose things. All right, so we're ready to bring the adhesive in. I'll even get it a little bit dry. I'll bend my applicator like this. We like the little puffy brushes because it allows us to open the matrix. So I can open the matrix like so. I'll come in here and we're going to massage adhesive into dent and tubers for a full 20 seconds. Now you can hold the incisal edge. We don't recommend holding the lingual. You can hold the incisal edge just like a steering wheel. So let's go ahead and massage for a full 20 seconds. Happy birthday to you, as you know. Then we're going to air thin. Make sure that when you air thin, you're getting your air thin very aggressively at the gingival. We don't want a lot of pooling at the gingival margin. And then we're going to go ahead and light cure. 10 seconds is plenty of time to cure the adhesive over the dentin. We're not covering the enamel right now. We're going to save that for later. So that's 10 seconds. And then I want to make this very clear. Every single time we injection mold, there's 3 phases. Number 1, adhesive as a surfactant. Number 2, look at my big old fingers. Number 2, hot flowable. Number 3, hot paste. So let's go ahead and do it. Let's get adhesive in here a second time as a surfactant. We're going to go ahead and get everything wet. There's no need to massage the adhesive this time. Just splash it on and go. Just splash it on the enamel, splash it on the enamel, and air thin gently. You want to leave a little surfactant here. So you don't need to air thin this as aggressively as we did last time. Just gentle air thin to drive off the solvent, and also to make sure you got the whole tooth wet. Then we're going to bring the hot flowable in. We're going to come in, and we want to inject at the matrix tooth interface. That's a theme we always want to really harp on. So we're going to inject at as close to right angles as we can to the matrix tooth interface. So you want to start injecting. You bring the cannula from the facial, and then insert it as far as to the palatal as you can. I don't want to marry this mid-interproximal, so you want to start on the palatal. Here I am injecting into the matrix tooth interface. I'm displacing my surfactant, my uncured adhesive. Perfect. And then I'm going to come up, and you have to drive the composite through the contact area. So come up and drive the flowable through the contact area just like that. And that's perfect. Now, if you fill it up with flowable, no big deal. But that's about the right amount of flowable. Okay, everybody do it. So I'll give them a couple seconds to do the facial. Once everyone seems to have done the facial, then I say, stop, let me see your eyes. Okay, and then we have a little fun. We say, let's crank the patient's head around backwards. And then we're going to come in. And of course, we're always going to injection mold into the flowable that went around the corner. So if I can injection mold here, this is safe. This is dangerous. This is safe. Come in here and see a little air bubble I'm pushing out. Injection mold as close to 90 degrees as we can to the matrix tooth interface. We've gotten rid of the bubble, and then come up and coat the contact from the lingual. Go ahead and coat the contact from the lingual. And it's not a bad idea to go ahead and fill the lingual enough so when the paste comes in, we won't trap a bubble, okay? Everybody do that. And then I give them a couple minutes so everybody does the lingual. I like to let everyone do it together. And so we stop, make sure everyone's done every little step along the way. We can let them kind of run free later, I think. Okay, so now let's go ahead and bring in the paste. If you can, squeeze a little bit of the air out of the tip. My assistant does that for me. There's your molten paste. I want to brace my fingers here. We want to always inject against back pressure to create thixotropic flow. If you want to brace the incisal edge, you can. And we're going to push this in, always seeking some sort of backstop. So I'm either injecting against the matrix or I'm injecting against the flowable. and I'll pinch it off against the matrix. You're going to use most of this compule because that's a big cavity. Now, I know you're freaking out right now because it's a lot of composite, but trust me, you're going to want all that volume. Grab your dry brush. Here's your dry brush. Grab your dry brush. You can put a contour angle on if you'd like. And then we like to come in and remove any excess that's on the wrong side of the matrix. Now, these gums are pretty stiff, but in the mouth, sometimes we'll see a little bit of flowable go on the wrong side of the matrix. If you want to go ahead and gently massage the composite here, you could minimize some of the finishing because the matrix is not going to control it right there. So you can just kind of massage that if we're not trying to cover any cervical area there. And then what we want to do is to trowel. That's the word that we use, and say, have you ever seen somebody pouring asphalt, or excuse me, pouring concrete? They pour the concrete and then they trowel. It's an important word in Bioclear. We want to trowel the excess. What are we doing when we trowel? What we're doing is we're lowering the mountains and we're filling in the valleys. So we're not worried about the mountains. What we're worried about are the valleys. In other words, if you have a depression in the middle of this infinity edge area, because remember, this area, we do need this for aesthetic blending. So the matrix does not always cover everything that we need. So the troweling is important. And Bioclear is all about having excess in that infinity edge zone. So I've troweled that. I've lowered the mountains. I've filled in the valleys. And now when I cut this back, I'm not going to end up with a depression someplace that's going to collect stain. So everybody, let's go ahead and trowel that paste. And there's a little bit of flowable there that will help you with your troweling. Okay. Let's go ahead and cure. We'll do 10 seconds on the facial, 10 seconds on the lingual. If it's a large restoration, I'll actually do 10, 10, 10, and 10. You can't over-cure the composite. Okay, don't take your matrix off yet. You got to play policeman or policewoman every time with these folks. You want them to not be frustrated. You want them to enjoy the recipe. So it is so helpful. And this Explorer is actually one of your most important Bioclear instruments. The shaft of this is 2 to 3 times as thick as a normal Explorer. The point stays a lot sharper because of how thick the shaft is. We use this to pry the teeth apart, to get matrices in, et cetera, et cetera. Very important instrument. So I like to use the straight end. We're going to remove the matrix, make sure to release under the contact. Make sure to release under the contact completely on the facial and lingual. Now, the matrix is smoother than a metal matrix, so it comes away easier than metal, but it wraps the tooth so much that if you don't completely release it, it's hard to get off, it's uncomfortable to the patient. And then I go ahead and I like to release this one. Grab your restorative hemostat and pull it out toward the incisal. And then wiggle the teeth in the dentiform. You do not have a periodontal ligament in this tooth. So if you don't wiggle the teeth, they won't. Now my tooth's got a little perio. If you don't wiggle the tooth, then it won't bounce back and close that beautiful contact. Look how broad that contact is now. So what I always tell doctors is it's not just the tightness of the contact, it's shape, position, and size. The shape, position, and size of the contact is key. And so before we now you could do this a couple different ways, but what you could do is you could stop and extract, and you could look at the extracted tooth. The hazard of looking at the extracted tooth and the hazard of looking at the of the contact area is that if they had a problem, it's not going to look very good. So kind of depends. But if you're feeling confident, you go ahead and extract it and say, you're going to have adhesive that's going to go past your infinity edge down here. Now, if you actually had this on your patient, you have a 14 millimeter pocket. So you're not going to get a good gingival seal, when there's no attachment. But normally you'd have a beautiful attachment, and that's your infinity edge. Perfect, right? And then there's the dimple. There are no flat surfaces in nature. So the new goal of whether you're doing crown and bridge or Bioclear, is you're going to have the dimple. And that creates a beautiful, flat looking contact. But in reality, there are no flat surfaces in nature. So it cradles the neighboring tooth, and patients absolutely love a contact like that because it's orthodontically stable. These cupped contacts are the new excellent. So there's your cupped contact. All right. So in this exercise, at this point, we're not doing the Rockstar polish. We're just doing the cutback and the disking and saving the Rockstar polish for the black triangle exercise. So I'm going to screw this back in, and then we're going to go through the cutback phase. Now, the cutback phase of Bioclear is unique to Bioclear. It's something that everyone gets very good at. It's intimidating to everyone at first, so it's important to understand how the recipe works. So what we're going to do is we're going to section the excess. We're not going to grind it. We're going to section it purposely. We always cut dry because it's much safer. The composite gets a little bit softer right in front of the burrs, so you have to cut dry. You're not going to heat up the pulp. You just use a little bit of air with the handpiece. You're going to cut exactly 1 millimeter from the enamel, no more, no less. I tell myself this every time I do Bioclear. It's best to section from facial to lingual. It's a little bit unusual movement for most of us, but it's a much safer cut. 1 millimeter from the incisal edge, no more, no less. Then we're going to cut in 3 planes. Once again, we're going to be cutting about 1.5 millimeters from the facial surface because with Bioclear, we always leave just a little bit of more volume for aesthetic blending. So I'm going to cut about 1.5 millimeters from the actual tooth. So I'm going to cut 1. That's the incisal third. I'm cutting full out. My wrist is very stiff. If you take a look from the incisal edge, I'm about 1 millimeter. I'm about a 0.5 millimeter from my infinity edge area there. I need to take a little more volume in the middle of the tooth. So I'm going to do the incisal third. Then I want to do the middle third, and then the gingival third. Typically, we're going to have less excess in the gingival third because that's where the matrix is hugging the tooth better. So these are sectioning movements, not grinding. It's full speed. We're not sculpting and we're not marginating. We're simply sectioning the excess. I'm about 1 millimeter away from the tooth now, 1.5 millimeters. At this point, you want to go in with the disc, not the burr. We don't do any shaping with the burr. We don't do any finishing with the burr. This is for simply sectioning the excess. Try to maintain your mylar zone. Sometimes I'll grab a little pin and I'll come in here and I'll say, okay, here's my cutback zone like so, and here's my mylar zone here. You want to maintain that mylar zone as best you can because it's the best polish in the world. Now we can go ahead and shape the lingual if we'd like. Once again, I'm not going to marginate with this. I'll marginate with I like to marginate with the brownie actually, or the little Q finisher burr. So we're getting very close to the enamel interface, but we're not touching the enamel. Don't touch the enamel. Don't touch the enamel. I tell myself that over and over again. Now, one thing that I neglected to do, but you can do, is when you do the lingual on this exercise, because the lingual is so convex, you could actually take your paddle and have pressed it against the lingual when you light cured. I did neglect to do that, and that's not a bad idea. So sorry they didn't do that. But it's nice to come in and press this against the palatal, just like this, the convex end of this, press it, and then light cure, beep, beep, because when the paddle comes off, they don't have to do any palatal shaping. We're used to palatal shaping, they're not. Okay, so anyway, that would have been a nice addition. But I'm not doing this recording again. Okay, so the next thing we're going to do is get into your dish and grab your mandrel. Go ahead and grab your mandrel, and we're going to put the disc in the classic position. Make sure and grab a large disc, not the small. So grab a large disc, and we're going to use it in the classic position, which is the disc facing away from the mandrel and away from the handpiece. So let's go ahead and put our disc in the classic position, and we'll show you how to use it in the inverted position shortly. And then we're going to bring the disc in. Make sure you can see the abrasive when you're disking. We don't want to disc this direction because that'll create a really ugly incisal edge, an unnatural edge. I want it this way, not this way. And it's good to be really clear on that. So I'm going to come in and I'm just going to lay this full speed against the tooth. And in the mouth, the enamel will protect the tooth from the disc, but your dentiform is very soft. So as soon as you start to see the dentiform coming through, you stop. In the mouth, it's no big deal, but in this case, you may over-shorten your tooth because these dentiform teeth are like butter. There we go. So my incisal edges are true. And then I can come in and use the disc in this position. I want to go ahead and begin to marginate and marry my man-made or woman-made surface with the disc to the mylar zone here. So you're coming in and you're disking like this. You can begin to marginate now. We're going to leave a little bit of excess. Nobody will know. If you don't leave excess, you're going to get stained. So part of the whole miracle of Bioclear is the infinity edge, which means we leave just a little bit of volume for blending. So I'm slowing down. Now I'll take the disc into the inverted position. I've sculpted the incisal third. I've sculpted the middle third. For the gingival third, it's nice to have the disc in the inverted position. We sort of chop it like this. And then the powder, leave it. Don't let your assistant blow it away. That powder, remember the old scanners that use powder? It helps us to see. Leave the powder there, and then take your disc and just slowly start to marginate that area. And it looks beautiful on enamel. Now it's identiform. It's not going to blend as nicely. But that's how we get that beautiful infinity edge. And then we'll go to the Rockstar polish later. You see that little powder trail? We've got to keep going in there till the powder trail is gone. And that's why we did all that troweling. If I hadn't have troweled this, I'd have a whole bunch of those little white spots right there. So let's take a look from the incisal and see how we like the shape. We're a little bit convex right here. So we'll come in here and just flatten this area here. You really do need to look down the incisal edge with your mirror to see these issues. Now this is as far as we're going on this exercise. We're not going to do the Rockstar polish here. We'll save the Rockstar polish for when we do the black triangles. If you see little white spots like this, we will talk about augmenting. I think I'll wait till the next exercise to talk about augmenting, since we're not really going to polish this tooth anyway. So we do get little white spots. That means there's a bubble in the composite, and we will augment those areas. It's part of modern composite, but let's take a look at your tooth. You should have this beautiful mylar zone, the disc finish, marginated. If you have any bubble areas, we'll take care of those. I'm still a little full here. So I'm going to take the disc, now that it's what we call a seasoned disc, and come in and make sure that I don't have excessive amount of contour. So this is all up to you, but that is a nice polishable surface. When you have concavities like this, those teeth are so hard to keep clean. You're going to get stained. Bioclear is best when it is a continuous convexity. So there's the disc finish. And we're ready for our next exercise. Okay. And I don't know if we're sending photos in or not. So let's go ahead and stop the recording.
Mm-hmm.